Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! Facial balancing. What does that mean? It's a current buzzword and has often been used to refer to non-surgical facial treatments like injectables, but when we take a closer look at it, it's actually an idea that's been around in the plastic surgery world for ages. Thinking about its more global meaning, it's a concept that should really be taken to heart. Sometimes we may look in the mirror and really focus on one area we just don't like, but lose sight of the big picture. Pulling the lens back, how does that one problem area fit into the balance of the whole face? Maybe that feature is actually just fine, but treatment in other areas might restore its appearance to a more aesthetically pleasing one. Or perhaps a combination of procedures will achieve that goal. What are the potentials? What could be involved? What outcomes should we expect with facial balancing procedures, whether surgical or non-surgical? Today we have Dr. Raja Mohan to make it all clear. He adds his own perspective on the topic and has some enlightening things to say. Take a listen. Well, I'm pleased today to welcome Dr. Raja Mohan, or some people just call him Dr. Raj. Now, he is a plastic surgeon in private practice in Dallas, Texas. He trained at Johns Hopkins, and he did a fellowship at the Dallas Plastic Surgery Institute. Welcome.
Thank you so much for having me on your show.
You're so welcome. This is going to be fun. We have some interesting things to talk about. I would love it if you could tell us a little bit about your current practice. We know it's located in Dallas, Texas, but what type of patients or cases do you focus on mainly?
Absolutely. So I've been in private practice in Dallas and been on my own since 2019. And
right before COVID.
Exactly, yeah. So it was a big, started right before COVID, and the first year was quite a roller coaster. But over time, I focus on aesthetic surgery, and I kind of do the whole range, or kind of the whole gamut of plastic surgery in terms of aesthetics. For example, breast surgery, facelifts, rhinoplasty, tummy tucks, mommy makeovers. One thing I do a lot of is liposuction with definition. So high definition liposuction.
Yeah, really creating that sculpted look.
Exactly, yeah. So that's one of the things I do, something I enjoy, but I also do kind of the breadth of all of aesthetic surgery.
Yes. And you do facial plastic surgery, which is what we're talking about today, facial balancing procedures.
Correct, yes. My fellowship in Dallas is where I really was introduced to all the nuances of doing a facelift and rhinoplasty. I trained with Dr. Rorick, Dr. Burr, Jay Burns.
Big names.
These are all masters, and experts in the field. So they taught me the details of facial plastic surgery. And since then, it's been a part of my practice. It's been a very interesting journey because a lot has changed with the procedures, and there's a lot of innovation and a lot of things that are shared now online through social media and different platforms, and it's been a very neat time to do those procedures and kind of learn more about them.
Yes, that's great. Well, we want to harvest a little bit of that expertise in our conversation today.
Sure.
And so our topic is facial balancing procedures, but for the listeners, could you just explain what we mean by facial balance?
It's a good question. So there are a lot of buzzwords in plastic surgery, and I feel as though in the last 2 years they've been popularized by social media or something on the internet. Somebody says something, mentions something. So facial balancing to me is one of those terms. When you think about the background, it's nothing new. I believe that in plastic surgery, right, we always want to make things look beautiful or look better. We do try to aim for symmetry, and we try to think of sort of what is the ideal and what can we do. Mm-hmm. So facial balancing is sort of rooted in plastic surgery principles, where whether we are doing a surgical procedure or something non-invasive, the whole goal is to make the face look younger, at the same time symmetric, kind of fitting that ideal that we envision for that patient. And when you look at the marketing and when people, like I say, mention this buzzword, they're going to point to certain procedures that they believe do facial balancing. But, essentially, I think, like I said, it's something that we've always thought of, but now we're starting to talk about certain procedures to help achieve that.
Yeah, and you're looking at the whole picture.
Correct.
Rather than just focusing on one little area that someone might be concerned about.
Right.
Well, just as everyday humans, sometimes we just know when a face has harmony in its appearance or it doesn't. But when you're evaluating facial balance professionally, are you measuring things? Are you eyeballing things? How do you evaluate it? Is it all the training that you've had up to this point that you bring to that consultation room with the patient, and you can tell that, this face is out of balance or it could benefit from some type of balancing procedure, as we're calling them?
Right. So the other thing I want to add, I think in general, facial balancing, or the buzzword I should say, is related to using fillers, Botox throughout the entire face to achieve symmetry and to volumize and to improve the look. Mm-hmm. But I believe that also translates into surgical procedures. And, every surgeon is different, because plastic surgery is a different specialty from the rest of medicine. There is an artistic, creative side to it. There are certain plastic surgeons I've met who were artists, or they do sculpting. And to me, they have... how do I describe it?
Have a certain eye, you mean?
Yeah, they have a certain eye, but I equate them more to like fine artists. People who are professional painters, dancers, the way that they think. So a lot of them don't really measure. They sort of have a vision in their mind. They're able to create that with their hands,
Right.
And so hard to describe that whole process. I approach it from a different angle, and maybe it's because I'm more left-brained. So my background, I've always enjoyed math and science.
Me too.
And so my undergrad, I had a math degree. I'm very technical. Mm-hmm. So the one thing I liked about plastic surgery was that you don't necessarily have to be an artist by trade or profession. I look at myself more like a designer or an architect. So I like to measure things, look at things on a computer, and look at proportions and numbers. And so I sort of take my background and even with all this new technology, same thing. So applying technology, applying numbers, trying to see how I can improve the surgery or how to execute it. So I'm taking it from a different angle, and there's nothing wrong with either approach. I would say I think about it more like a designer architect, and
I like that.
That's how I'm able to get to my end point. And then I have friends that are the complete opposite. So,
and your method is an art form as well. It's just translated differently,
right?
Shall we say?
And this is something kind of a way of thinking I apply to all my surgeries, not necessarily the face, but when we talk about the face, it's interesting that from a mathematical standpoint, there are many papers and many things written that talk about different numbers and proportions and ideals. Mm-hmm. We all have a certain foundation in our anatomy of what we're born with, and we all age in our own way, and we all have different features that are attractive or certain things that we may want to change. So everybody's a little bit different, and I think kind of have to judge, look at the type of tissue and what's there to really determine what can be done to address any patient's concerns.
Sure.
But yeah, balancing itself, like I said, is more of a new term related to using injectables to achieve symmetry or achieve certain facial proportions.
But we plastic surgeons have been balancing for a long time, haven't we?
Right.
Surgically and non-surgically.
Correct, yes.
Do you feel that the concept of balancing, facial balancing, is primarily focused on symmetry, or do you think proportions of various facial features are part of that as well?
I think it's a blend of both. I believe that one, it is trying to achieve symmetry, but keep in mind, I think that, you've probably seen those pictures side by side, like the left half of the face is different from the right half, and that's normal. That's the way it should be.
Right.
So,
people don't realize that, do they?
yeah, because, when I'm doing injectables, like injecting the lip or the cheeks, it's interesting. This even applies to breast surgery. You make a modification, people actually notice the underlying asymmetries. They tend to be more apparent after a treatment.
Mm-hmm.
And I tell them, look, it was already there before. I'm only either volumizing or tweaking one thing, but I'm not changing all the parameters to where that asymmetry is completely gone.
Right.
But when it comes to facial balancing, there are some people that do have a marked asymmetry, and like injecting more filler on one side versus another, or maybe varying the units of Botox, you can get closer to a symmetric look, but that still looks natural. Because I think that's one of the big things these days, along with balancing, is I would say a lot of patients and surgeons are now trying to make the results look natural.
Mm-hmm.
People want to look good, but at the same time, they don't want to look like they've had something done or that something is off.
Or exaggerated, yeah.
Right.
Got it. Well, as we talk about proportions within the face, how do we know what those proportions should be? And are there variances based on gender and ethnicity, cultural?
Yeah, that's a great question. You could look at it from one of two ways. I would say if you look at ancient times, many of the ancient cultures, especially the Greeks, had come up, and even like Leonardo da Vinci, had come up with certain, like I said, golden ratios and proportions and numbers, which have been heavily cited. But the thing about it is, it's not sort of a one-size-fits-all approach.
Yeah.
So those are very helpful, and they, especially even if you think about art, which plastic surgery is related to, in art, those proportions tend to be more pleasing to the eye and just our subconscious. When artists use those proportions, we feel like, okay, yeah, this looks good. Aesthetically, it's beautiful, it's proportioned, it's something that I would want to hang on my wall or have an art museum. But the other thing that's happened, I think, in the last 25 years, there's been an explosion of papers and information that's being published and presented. And if you take a lot of the procedures, if you look at the face or the breast or the body, there have been many, many studies focusing on proportions and measurements related to different genders, different ethnicities, and trying to kind of show surgeons, all right, like I remember reading a paper recently that they looked at ideal location of the belly button, and they studied photos of models, like Playboy models and other models that were in magazines, of like where the belly button should be, how long it should be, what should be the width, what should be the shape, to help us when we're planning a tummy tuck. So when you look at our literature, there are a lot of studies done where people have looked at many different body parts and tried to figure out what are, these average numbers, or what's sort of normal, and what should we try to aim for when we're trying to modify things. And it's very helpful, especially since I like to measure and I like to look at numbers. When planning surgeries, it's very helpful for me to look at those things. So even within the face, there have been many studies that have looked at different ethnicities and genders, and when you do certain maneuvers, how much is that going to change, the length of the nose or the length of the cartilage, those types of things, different angles. So the long and short of it is just doing a literature review and looking at the published literature is the best way to kind of find those differences among ethnicities and genders.
Mm-hmm. And as we kind of move away from some of those classical proportions that you referred to and are incorporating different ethnicities and cultural appearances, do you think that overall the kind of global aesthetic ideals are changing? Or at least there's more openness?
This is how I look at it. This is just my opinion, and I am generalizing. Just going to use the United States as an example.
Yeah.
We as a country, we're very heterogeneous. We have all cultures, all ethnicities. And I think what's happening now, just in terms of the mainstream, is we don't really have one specific ideal. like we used to.
Yeah.
And I think what's also changing is it's no longer about a celebrity or one model or one actress. With this, new wave of influencers and people of all ages that have some influence or some say, what I'm noticing is people of all types, all genders, all ethnicities, just all backgrounds. Everybody's finding something beautiful about different people. So I don't really think there's one specific ideal or norm,
Yes.
especially in American culture. I think that we're finding many different things beautiful, and it doesn't just have to be one way.
Yeah, I like that.
Yeah.
Well, we've talked about how the concept of facial balancing is a bit of a buzzword right now.
Mm-hmm.
It's getting a little bit more attention, and there seems to be a little more, maybe a higher demand for it. And perhaps there is a younger skewing of patient age.
Right.
Is that what you're finding? And do you think that social media is a factor? What are your thoughts about that?
Yeah, that's another good question thought. And I'm saying this just based on my own experience.
Yeah.
Even in my training and going into practice, when we talk about facial aesthetics, the main thing we would focus on, and I spend a lot of time with facial plastic surgeons, people of ENT background, as well as, in my fellowship. It seemed like it was two things we were focused on, either rhinoplasty,
Nose.
yeah, for aesthetic or functional reasons, and you would have some younger patients because some of the things that they were concerned about were genetic or hereditary.
Yeah.
The other thing was aging face. So it was always patients above age 40 concerned about their eyelids, their brows, their face. What I'm noticing, I think it's a social media trend. I'm getting a lot of younger patients between ages 20 to 40. Maybe they're seeing selfies, they are focusing more on the face because of Zoom meetings and taking photographs of themselves, or seeing photographs on social media. And they're exposed more to the things that are out there because, as you know, with all the platforms, if you're interested in something, the platform keeps feeding you with new content related to that. So a lot of younger people
get inundated.
Yeah, I don't think, without the phones, they may not even know what a facelift is. But if they happen to think about it, talk about it, and they start seeing videos, what they're noticing is there are a lot of procedures that are being done on people who are younger, and I believe they're all variations on a theme. They are smaller, less invasive versions or procedures that are all somewhat related to what we do on the aging face. So, for example, mini neck lifts, mini brow lifts, lip lifts. There is definitely an increase in demand for procedures that we felt were meant for the older population, but people who are younger do have an interest and demand for it.
Yeah, on a smaller scale.
Yeah.
Yeah, got it. We touched on this a little bit, but as we're thinking about treatments directed at facial balance, how much need for that comes from the inherent facial structure a patient is born with, and how much comes from changes associated with aging?
I think it's a mix of both, and obviously it depends on the patient. I mean, certain anatomical findings, it's a hereditary thing, they're born with it, like we talked about with the rhinoplasty. But all parts of the face do change with age, and different people age differently at, different decades and in different ways, and we're all very different. That's why I feel a lot of the procedures we do on the face, there really isn't like a cookie cutter approach. Everybody that comes in might need something different to get the best possible result.
Yeah. So we can think of it as sometimes restoring balance that has shifted over time, or maybe generating balance that was not quite there to begin with.
Right.
So it can be either of those, and maybe a combination.
Correct, exactly.
Well, let's break it down a little bit more and talk about areas or sections of the face that we should look at to assess facial balance and proportion. As you're evaluating a patient, someone comes in for treatment of their nose, of rhinoplasty or something along that line. What are the areas of the face that you are looking at to assess their facial balance globally?
It's a good question. Kind of how we're classically trained in plastic surgery is to split the face into different sections and analyze them. And for me, the easiest, because I think it relates to the treatment plan, is if you just look at the face vertically splitting into thirds. So I consider like, the upper third is the forehead and the brow, and then you move down to the mid face where now you're getting into the territory of the eyelids, looking at the cheek. And then the lower face is the perioral region, as well as looking at the neck. And then, of course, you look at things laterally also, like
from the side, yeah.
the temples and the lateral face. So I think just breaking it down into these different regions and zones and looking at it, since everybody's different and they age differently and at different time points, I think looking at every section, examining it, looking at it, from a static point when they're not moving and when they're moving, and then also kind of looking at peeling back layers, layer by layer, right? What's the quality of the skin? What about the soft tissues? What about the distribution or the volume of the fat? Those are the things to kind of look at to determine what the plan should be for any facial balancing procedure.
That really enhances the result.
Correct.
I would imagine.
Yeah.
I think it is so easy for patients to come in hyper-focused on one of those sections you talked about and not be seeing the whole picture.
Right.
And I'm sure part of what you do is just take a step back and look at everything and discuss with that patient some other things they might consider. I'm curious if there is a combination approach to what you might do. Are you sometimes augmenting one area, making one area fuller, and then at the same setting reducing another area that perhaps is too full already, and you're trying to restore proportion and balance that way? Have you found that to be the case?
Yes, absolutely. I think one of the things you brought up, sometimes some patients might be hyper-focused on one area, but they would have a better result if they addressed different areas, right?
Yes.
And that's kind of the point behind balancing. And from the standpoint of the term becoming popular, I think that if you look at it that way, balancing is about using filler and Botox for the entire face. And in a way, the prior buzzword that sort of relates to this, I think of it as like a liquid facelift. So I'd worked with some dermatologists that had patients that did not want a facelift. They just did not want to go under. They didn't want any cutting, but they were willing to spend a significant amount of time and money on and come every 6 months for filler treatment. And they would get a lot of syringes throughout the entire face, like their temples, their brow, their cheeks, all these different zones. And it's interesting how it adds volume where it's lost, and in certain areas it can give the illusion of like being lifted or having a facelift. So in a way, they kind of underwent a balancing procedure. But if you look at it from a surgical standpoint, doing all of the surgeries that are necessary to address the patient's concerns and their natural anatomy can give a more comprehensive, balanced look to the whole face. So usually what I find is the patients that address multiple areas and do other treatments that are non-surgical, like, proper skincare, different maybe lasers or peels, all the things in combination can help maintain and produce the best result. But, a lot of it depends on timing and cost. And so there's a lot that goes into it.
Yeah, of course. Well, we've been talking about non-surgical methods of treatment to achieve the goal of facial balance. What are some of the surgical things that might go along with that as a complement to the non-surgical things? I'm thinking specifically about cheeks. What do you think about buccal fat removal or fat grafting to the face where it's needed, or various other things like that?
Yeah, that goes into what you'd mentioned before about reduction, augmentation. When it comes to the face, I feel like the aging process or even anatomy, it's not one specific problem. Traditionally, a lot of people thought that the whole goal is to tighten the face as much as possible.
Yeah.
And yes, some structures do need tightening, but that's not the only thing that can enhance the face.
Yes.
So, when you think about augmentation, some patients do benefit from implants or facial fat transfer. I do both of those procedures quite commonly.
Like a chin implant or?
Yeah, chin, cheek implants, or adding volume to those areas. Because what does happen, and this has been well characterized, there are specific fat pads and anatomical compartments in the face that do deflate and lose volume with time and show signs of aging, and with fat transfer the person does look more youthful. It's the same concept as using filler.
Mm-hmm.
Now there are areas that with aging or just anatomically can be fuller, like the buccal fat pad, or certain regions that either require reduction, like direct excision or liposuction, or may need some tightening to minimize the appearance. It really depends patient to patient.
Yeah.
So some do need removal, some need some sort of addition, and tightening is done in certain parts of the face, especially where the soft tissue structures have become lax or deflated or have
Mm-hmm.
lost their elasticity with time.
With age, yeah.
Exactly.
Surely.
Yeah.
Well, and when you're treating a patient with non-surgical means, first of all, do they require maintenance? And if so, what type of maintenance do they require? Usually we think of surgery as having a little bit more lasting effect, but what do you find and what do you tell patients?
Yeah, I feel what's ideal is surgery is going to have a very lasting effect, and it's going to be very dramatic. But in a way, let's just take a facelift, for example. For me, a facelift is you're turning back the clock, like winding it back.
Yes.
But then the clock's going to continue.
It keeps ticking.
Right. So some patients, if they get a facelift early in life, like around age 40, it's quite likely that they're going to need another one in the future.
Mm-hmm.
The other thing that I think is important, and I think a lot of patients, people I know even in Dallas, understand this, is that it's not just the deeper structures, but it's also what's happening at the surface level. So there's a lot of focus now, in a good way, about skincare and maintaining the youthfulness of the skin. So, of course, the basics: moisturizing, protecting the skin with sunscreen, and then now men and women are getting very much interested in medical grade skincare and doing different treatments periodically every 3, 6, 12 months to maintain the youthfulness. And
the surface, yeah.
Yeah, preventing aging, like wrinkles and pigmentary issues and freckles and that sort of thing. And there's different ways of approaching it. Some people, and I work with a lot of dermatologists here, and we kind of talk about this and debate it. But there's some patients that like the injectables,
Mm-hmm.
and that's great. And then there's some who do peels or facials regularly, and there's some that are doing light therapies or laser therapies regularly.
Mm-hmm.
So there are a lot of things out there to basically maintain the quality of the skin, and there's been so much innovation in the last 20, 30 years. It's amazing how much research has been done and how much evidence there is, and how we know that there's so many things that can maintain the youthfulness of one's face.
Yeah. And I would think that just focusing on one avenue, one type of treatment, though, will only get a patient so far, and sometimes adding a different type of treatment, adding laser, to someone who's only having injectables, or, vice versa, I think can really enhance the results that are achievable. And as you've said earlier, give you a more comprehensive rejuvenation rather than just kind of a one-track pony, so to speak.
Right. I do agree with that. Yeah, absolutely. And, I've had patients in both categories, and I feel like the ones that just do a procedure, yes, it does help, but I don't think it's the optimal, especially like when we talk about facial aging. I never feel like it's a one and done thing. Like, okay, you do one procedure and everything's corrected.
Right. As much as patients would like that.
Yeah. And it's
not really realistic.
And the other thing I've thought of is it's not really just in plastic surgery. Like, let's just take any aspect of medicine. If somebody gets heart surgery for coronary artery disease, that doesn't mean you stop taking antihypertensives and statins and all that. You still have to take those pharmacological medications.
Maintain.
For maintenance and heart health, to prevent your blood pressure from going up and preventing your cholesterol from increasing. So this kind of applies across the board.
Yeah, excellent point.
Yeah, we do need to fix the issue, but we need to do what we can to prevent it from coming back. Or even from a young age, which brings up another interesting point. We can do a lot of things in a preventative way for anti-aging, but I've noticed, I know I'm going off topic, but even in Dallas,
it's all good.
It's gotten a bit crazy in a way. Teens and young children and their interest in skincare. You go to Sephora and Target, there are a lot of items directed at young children, and I do know a few. I've had some parents contact me, and they're like, do you mind talking to my children? Because
Wow.
they applied certain things, they had some bad reactions, and I just need, your opinion as a professional who's in the field to talk to them and tell them what they should and should not do. So that's another thing. I love prevention, but it's even interesting now that there is a trend where sometimes it's getting a little out of hand.
Yeah, I mean, that could be concerning.
Yeah.
I'm wondering if it's sometimes challenging to achieve good facial balance for patients. What might be some of the obstacles to reaching that goal? Is it the patient, or is it physical findings on the face, or what do you find?
It's probably, the physical findings, the underlying anatomy. I mean, when you think about it, whether it's surgical or non-surgical, we only have certain tools.
Yeah.
And there's only certain things that we can fix and address and certain things we can't. So, I'll give an example of this. One condition is called hemifacial atrophy, where there is a major, significant difference from one side to another, because this is a medical condition where one side of the face just doesn't have soft tissue volume. As plastic surgeons, we have certain treatments we can do. We can do multiple rounds of fat transfer, we can do a flap surgery, but the reality is, even with the tools that we have, we are never going to be able to exactly match the opposite side. And there are even some conditions out there that relate to when you talk about bony abnormalities. There, one side, like one is called hemifacial microsomia. So one side of the face, the bones are underdeveloped versus the other, and there are techniques to fix that. But achieving perfect symmetry is near impossible. So
Yeah.
that's what I'm saying. There are certain cases where I think patients need to understand, aesthetic cosmetic patients, is that we can enhance things and make them better, but getting things perfectly symmetric and balanced may not be possible and may not even look right, because when they've done those side-by-side photos where, like, if you took the left side of my face and then mirrored it and made it look like my right, I won't look like I normally do. I'll look different. So, yeah.
Mm-hmm. Oh, interesting. As we're talking a little bit about patient stories, do you have any patient stories you could relay to the listeners which might illustrate some of the benefits of facial balancing, even changing quality of life? Anybody you've encountered who really noticed how this concept improved their life?
I have one patient in mind who's also a friend of mine. She lost a significant amount of weight on semaglutide. These GLP-1 medications, weight loss medications, have been extremely popular, all the rage over the last 2 to 3 years. So she lost about 100 pounds. And, she understands this, and we've talked about it. She is a candidate for a facelift, and it's just, I think for her, she just needs more downtime. She's retired, she's been traveling a lot. She just doesn't have the time at this point to undergo surgery. So she'd asked me, is there anything you could do? And I told her, in lieu of a facelift, we could do, quote unquote, facial balancing, where I inject Botox and multiple syringes of filler to try to, make you look more youthful, or do the best I can without doing a facelift.
Improve the proportions and volume and all that. Yeah.
Exactly, yeah. So I actually injected 6 syringes, which is much more than what I typically do.
That's a lot, yeah.
Yeah, most of my patients, I'm injecting 1 or 2 to fix a problem area, but we did 6 in her, and I kind of volumized the entire face, because I felt, one thing with these GLP-1 analogs is there is loose skin throughout the entire face. We're talking about neck, jawline, cheek. That, to me, 1 syringe is just a drop in the bucket. So I told her,
yeah, it's not going to do anything.
Exactly.
Yeah.
I was like, let's do a comprehensive treatment, as many syringes as we need to do the best we can, understanding that we're not doing a facelift. So I did all that, and it was actually pretty transformative for her, because that's the thing with the weight loss medications. When you lose weight rapidly, you are losing a lot of volume in the face, and replacing all of that volume with filler or fat transfer can bring the face back to where it was, when they had a little bit more volume there. So, she had kind of told me, I'm quoting her, she said, after the weight loss, I'm happy I lost the weight, but I felt like my face melted away.
Yes.
And replacing the volume, she felt like, okay, I have my face back. Like, this is how I normally look.
Oh, that's so wonderful.
Yeah, so, it was amazing for her. This is, like I said, a real confidence booster, because this is all of plastic surgery. I think a lot of it is these physical things that concern us, it's all rooted in our own confidence and self-esteem. And face is a big part of that, because now that we're not really wearing masks anymore.
That's right. The first thing people see.
Yeah, that, something that we can't really cover up in the summertime. So there are a lot of people out there who are concerned about their facial appearance, and especially now that they're seeing it more on phones and other devices. So yeah,
right.
she was happy. I mean, she sent me a lot of photos and she was thrilled, and the only regret was she was like, oh, this doesn't last. So after after a year, I was like, okay, when the time comes, we're going to need to do the facelift and the fat transfer to get you something that is longer lasting.
Yes, makes sense. Oh, that's a beautiful story. Gosh. Well, thank you so much for explaining this interesting topic for the listeners. And I'm just wondering if there are any final thoughts that you have about our topic of facial balancing, or just about plastic surgery in general. Anything you want to leave the listeners with?
I mean, the only thing I can say, because, like I said, facial balancing is sort of a new buzzword. And I always try to tell, even through my own social media channels and friends and family, is we live in an interesting time where there's a lot of information that's out there on social media and on many different websites. And there's a lot of fact and there's a lot of fiction. And I think it's very difficult for somebody who's not in the industry or who is a plastic surgeon to know what's true and what's not. So I would caution listeners that, okay, when you come across things that you like or you're interested in or that sound good, always just check with somebody you trust.
Yeah.
Lately, I've been seeing a lot of things, and people have been asking me things about these that they see on different social media platforms, and I have to tell them, no, I don't think that's true. There's not enough evidence. I wouldn't recommend spending money on it and trying it. So all I can really say is just be careful. And, I feel like your podcast is wonderful because you are interviewing a lot of experts in the field who are going to be very candid and honest and share their perspectives. And so this type of forum is great, and we need more of it. And that's really what I have to say, that I want to leave listeners with, is just be careful what you're seeing, what you're reading, and always verify. Yeah.
Well, thank you for that compliment. And Dr. Raj Mohan, it's been a delight chatting with you. Thank you so much for sharing the time.
I appreciate it. Thank you so much for having me on your show.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.